morning or good afternoon to everybody that's watching. Here are my disclosures. One thing I do want to point out is recently had a book come out last week, Live Younger Longer. I'll show you the cover at the end, but much of this is from that book. Our learning objectives today: review the role of lifestyle in the development of heart disease, appreciate the importance of diet, and understand the mechanism of benefit from physical activity in preventing heart disease. You know, it's interesting, if you approach medicine as a business, you would say, let's treat disease, because that's where you make the most money. If you would approach medicine to save the most lives and reduce costs, you would say, let's prevent disease. So let's talk about heart disease prevention. There are really four issues that are key factors with heart disease and all non-communicable diseases, for that matter: diabetes, Alzheimer's, cancers. They go on north, south, east, west. Nutrition, exercise, stress, and social support, and that's incredibly important. Sleep, smoking, spirits, and then, of course, weight. But what's the most important? Nutrition. Diet is now the #1 cause of early death and early disease in the United States, and the #1 cause of cardiovascular disease. But we all know a lot about nutrition, right? If you look at these numbers, I think not. In medical school, the training on nutrition declined to 19 hours, about 2.2% of time. Internal medicine and family medicine residency, 26% of programs offer training. That means 3/4 of them don't. And less than 1 in 5 trainees are confident in their ability to counsel patients on diet. And then in cardiology, you know, we're the ones that see all this disease. 90% of over 600 practicing cardiologists on a recent poll reported no or minimal nutrition education during fellowship. So I'm sad to say that doesn't look good for cardiology. But what's the diet? You'll get another excellent talk in a moment about diet. But the Mediterranean diet seems to be, I think, one of the best plant-based diets. We'll talk about this for a couple of moments here. Above the dotted line, you eat more of. Below the dotted line, you eat less of. So I like to tell patients, say, hey, you know, eat more fish, eat more legumes, more fruits, more vegetables. You don't just have less processed foods, less processed meat, red meat, dairy, and limit yourself to maybe 1 glass of wine a day. And if you look at the data here from the revised Predimed study, what's very interesting to me is the control diet is on the top line. In the Mediterranean diet with nuts or Mediterranean diet with extra virgin olive oil, you can see the event curves diverge very early. In fact, the lipids didn't change, weight didn't change throughout the study. So why? Well, it's probably an anti-inflammatory effect. The Mediterranean is the most anti-inflammatory diet we have. And people talk about eating certain foods as anti-inflammatory, and I try to get away from that with patients. I say, you know, your plate is the whole thing. You can't eat this food and negate that food on the other side of the plate. So you do lower MI, stroke, and cardiovascular death, and the greater the adherence, the greater reduction in events. Now, what events? Well, not just death from cardiovascular disease and stroke and death from cancer, but death with atrial fibrillation, and that's very interesting, and remember that because we're going to talk about that more in a moment. Diabetes, Alzheimer's, arthritis, Parkinson's disease, again, the anti-inflammatory effect, macular degeneration, and erectile dysfunction. It's the only diet I know that's been shown to reduce female sexual dysfunction. In fact, if you look at the diets, Mediterranean and DASH are the only nutritional patterns shown to reduce cardiovascular morbidity and mortality on prospective studies. And the more adherent you are to the Mediterranean and the vegetarian component of it, the greater reduction in events. So here you can see in quartiles, the more adherent to a vegetarian, which means less meat, less dairy, less poultry, less fish, you had a greater reduction in cardiovascular events and mortality. Now, some people will say, well, it's all about what you eat. And nothing could be further than the truth. They say, put this food in your mouth and that's all you need to do. Nothing could be more wrong. It's really about how much we eat, how we cook what we eat, where we eat, when we eat, what we're doing while we eat. And then I think the most important, literally, is why we eat. What drives us to eat? Because over half of what we eat every day is a habit. in our habits. First we make our habits, then our habits make us. And we need to be careful with that.